Today we're going to talk about nightmares. Have you seen that movie, Nightmare on Elm Street? The scene when Johnny Depp disappears in that bed? Well, hang on a minute. Falling asleep with a TV on your groin, that's a nightmare. I'm going to explain all, so keep watching. Hi, my name is Dr. Dev. Welcome to Sleep Talk with Dr. Dev. This is my assistant, Barney. Hey, Barney, how's it going? Or how's it not going? All right, Dr. Dev. Today we're going to talk about nightmares. Nightmares is extremely common. Tends to be more common in younger children, but can occur in adults as well. And basically describes that vivid nature of those dreams in REM sleep or rapid eye movement sleep that you wake up from and you're thinking, oh my God, what the hell was that? And your heart is racing and your brain is just pumping away almost. And guess what? It takes forever to get back to sleep. This is why nightmares is such a problem and how it interrupts sleep. But nightmares is a very common associative feature of many other sleep disorders. And I commonly see those with anxiety. They're very anxious in the day and they're very anxious at night, including the dream, and they have terrible vivid dreams that they wake up from. Similarly, I see a lot of people with post-traumatic stress disorder or PTSD. They have a lot of flashbacks in their dreams, and they have also wake up with this hyperarousal state, the feeling as if they can't get back to sleep, the recollection of unhappy events that's taken part in their lives beforehand. And also another common condition that we see with nightmares is with narcolepsy. Narcolepsy is a condition where REM sleep physiology is impacted upon, and they also have vivid dreams. But they also have vivid dreams when going to sleep and waking up from sleep, and they feel as if they can't move because they're in REM sleep. And in REM sleep, what happens is that your muscles all relax. It's called atonia. So people with narcolepsy have dreams when they've fallen asleep with the paralysis. It's called hypnagogic hallucination. There's also other things that causes nightmares, such as many medications. These are such as beta blockers or antidepressants, such as the so-called SSRIs or antihistamines or steroids. And in fact, sometimes heavy red wine with a lot of tannin and strong blue cheese. There you go. Didn't know that, did you? Now, when I see individuals with nightmares, I'm not particularly too interested in the actual content of the dream. I'm also interested in where it's coming from, obviously which psychiatric condition this might be, how it's impacting on the sleep, and also how it's impacting on the well-being. Now, nightmares is very different to night terrors. Night terrors tend to occur in non-REM sleep or non-dream sleep. And the difference is that there's very little recall in night terrors. They may bolt upright screaming, scare the living daylights of the person lying next to them, but there won't be any recall or memory from the night terror, whereas nightmares is a lot of recall. Both may look as if there's impending doom and there's heart racing and there's hyperventilation, and so they're very similar in that respect, but it's the phase of sleep, the night terror versus the nightmare occurs, that will give you a hint of whether they have a recall or no recall. Now, many people with anxiety and PTSD, obviously trying to understand how we can treat their psychological aspects of the disorder with clinical psychology, behavioural therapy is obviously critical. But there's many of those, particularly in PTSD, where the nightmares are particularly disruptive and particularly impairing on their well-being, and many drugs have been used to try and control nightmares. And unfortunately, many of these drugs do cause a lot of side effects. I see a lot of people with PTSD who have been in the military as well, and so there's a big drive in trying to find alternatives from these other psychiatric medications. One thing that I have used successfully for particularly nightmares in PTSD and anxiety is CBD oil or cannabidiol. Now, what cannabidiol does is actually reduce the hyperarousal, that flight, fright and flight, that cortisol that's flying around, and reduce that sudden startling effect. But for those that are still having bad recalls, particularly in PTSD, then data has shown and research has shown that a small amount of Tetrahydrocannabinol or THC will control and address those nightmares. So sometimes a combination of CBD with the THC would help. One clinical psychology treatment modality, an option that psychologists use, is something called image rehearsal therapy, or IRT. Now, what image rehearsal therapy, the basis of this is trying to displace the bad imagery in your dreams with more pleasant imagery. And so maybe speak to your psychologist or psychotherapist about this, but it's to do with training a new image before you go to bed, and then just focusing on the image. It might be a scene walking down the beach, or your puppy, or a picture of Barney.
Oh, sweet dreams.
And then what you try and do is train your brain to view that image so that it displaces the bad images at night time. If you think about it, if you're going to bed with a not so pleasant image, whether it be current affairs or bad news or movies like Nightmare on Elm Street, then that image will stay in that cerebral cortex of the brain and it'll pop up in your dreams. Unfortunately, in PTSD, many of these dreams are rehearsed, and that's why image rehearsal therapy might be one psychological technique to try and counter that. This is why it's so important to make sure you're going to bed with pleasant imagery in your mind. Now, if you're somebody who's having regular nightmares and you're really struggling with your mental health, go and see your GP and get a referral to a sleep doctor, particularly one of those who've had some experience in cannabinoid medicine or medicinal cannabis, to discuss this further. We are really trying to move away from those other drugs that are being used for nightmares because of the side effects. So medicinal cannabis might be another option. Cheerio, see you next time.